The Centre for Economics and Business Research estimates that around £48 million could be saved by moving orthotic services from secondary to primary care. Despite calls for change from within the NHS, little has changed and most still agree that orthotics is a Cinderella service, often hidden, often forgotten. But Peacock's Medical Group is changing that with its directly commissioned service in Southampton.
76-year-old Brian Smith lives alone and is suffering from diabetes-related foot problems. He loves going for walks but needs specialist care to manage his condition. Today he's visiting his local orthotist at Peacock's Medical Group clinic in Southampton. Peacocks are one of the UK's leading providers of orthotic products and services to the NHS and have been manufacturing custom-made devices for over 100 years.
Can you wear your shoes all day long?
I could do.
Or do you have to take them off when your feet get puffy in the afternoon?
Devices for complex issues like Brian's can be custom-made to fit each individual's need, whether it's for a trauma-related injury, a disability or a long-term condition like arthritis and diabetes.
An orthotic product is any device which supports the body from the outside. It can be used for something as simple as this elbow clasp or this walking boot, or something more complicated like a full body brace.
Devices can be used to relieve pain, prevent conditions from worsening, and in some cases resolve an issue completely. But most of all, orthotics are used to improve a patient's quality of life.
I don't like staying indoors too much. I like fresh air, so the shoes help me to do that. It's more comfortable with these shoes to get out and about.
However, despite growing evidence that change is needed, orthotic services are still traditionally delivered in a secondary care setting. This is despite a huge number of patient conditions which could be treated in a quicker and more cost-effective way within primary care. NHS-commissioned research recommends condition-specific direct GP access to orthotic services. It says that for every £1 spent on improving orthotic services, the NHS could save £4 in the longer term.
A more minor condition where there is just general foot pain, why would you want a patient to have to go be referred by GP into the secondary care environment to wait 6 months or 12 months to be then given an insole? That condition, which was a minor pain 12 months ago, becomes a much more significant condition, and actually when the orthotist sees the patient in the secondary environment is then having to talk to other specialists because the condition has deteriorated so badly, and the cost to the NHS thereafter is compounded significantly. Having an integrated multidisciplinary approach to our patient care and giving them access quicker to the service that they require has a profound effect on their patient experience and their patient outcomes.
This approach is already benefiting both patients and the NHS in Southampton. Peacocks has partnered with the CCG in the running of a multidisciplinary foot clinic involving diabetologists, podiatrists, surgeons and an orthotist.
Care closer to home is one of our key aims because it means that productivity is improved because we don't have to pay acute rates. Care costs more in a hospital. There's definitely a growing body of evidence that getting orthoses or getting input from an orthotist sooner in the patient pathway reduces costs further down the line.
With diabetes, there may be a need to see your GP, have your eyes photographed, going to a pharmacist to review medications. And if you have an active foot problem, that's going to require almost weekly visits to a foot clinic or a podiatrist, so quite a big time commitment. By offering a clinic such as this, and a multidisciplinary clinic, the patient can be seen by several healthcare individuals in one visit. If the orthotist is part of that service as well, it just helps add to that layer of care we're offering the patient, whereby once the medical, surgical and podiatry issues are decided and covered, the critical step around arranging appropriate footwear is not delayed.
NHS clinical commissioning groups have two jobs: to balance their budgets and improve patient outcomes. Commissioning primary care orthotic services gives patients early access to the right clinicians in the right setting, and that meets both these needs.